All right, welcome everybody. Hi, welcome to our Tuesdays to Your Health webinar series. And today we're going to be focused on sleep and specifically getting restorative sleep, which I call the holy grail to better health. And I'd like to spend some time today really just reflecting on different aspects of sleep and how we can find a way to get more of it. So welcome. If people have questions, feel free to submit it in the Q&A as we go along, and feel free to I'll answer those towards the backside of the conversation. I welcome people's thoughts. So, as many of you know, my name's Brad Jacobs. Thanks for coming. We'll record this as well afterwards and put it on YouTube, on our channel, YouTube channel. Dr. Brad Jacobs, for those that are interested in seeing it again or forwarding it on to friends, you can do so. And for those of you that are here live, feel free to put stuff in the Q&A so we can answer those live. So that's the nice advantage of being here today. So I'd like to provide an overview, really thinking about integrative medicine overall. So let me speak to that, and then I'll show you some slides, then we can go back to a bit more of a question and answer on the backside. So my approach towards health and well-being, and specifically sleep, is really focused on thinking about all the options together, right? So what are the underlying causes that disrupt our sleep that we may not be aware of? And then what are some of the sort of contextual aspects, whether they're environmental and social, whether they relate to our own health, or whether they relate to things that we're doing in our day-to-day life. And then when you think about what can we do about it, then the interventions that relate to some of those. And with respect to sort of therapeutics, if you will, a lot of what I'd like to focus in on really relates to sort of thinking about self-care, what I call self-care lifestyle, things that you can do on your own, maybe with some guidance from an instructor or something like that, that are sort of within your own capacity and sort of optimize your own innate healing capacity and restoring your ability to heal and get better sleep. And then the next level up would be things you could take by mouth. And that might include dietary supplements, for example, certain herbs, things like that. And then of course, medications that are by prescription. And we'll spend a little bit of time talking about that. There's a range of things that are before the things you take by mouth that really can be helpful. And we'll talk more about that as well. So whether a practitioner helps you with that, in other words, an acupuncturist or body worker or something like that, or a psychotherapist. So that's sort of the broad spectrum. I, as an integrated medicine physician, really like to look at what are the underlying aspects that are the root cause of sleep disturbance for you. And the vast majority of that, which most of us know, is really our mind, even when we think it's not. It turns out it often is. And then there's other potential root causes, and then address those, because often addressing the root cause will provide multiple benefits. So if you think about sort of yourself being tossed around on the top of the ocean, and you're getting pulled this way and pushed that way and tossed this way, as you start to sort of bring yourself down to the deeper waters, there's less pulling and tossing and pushing and pulling. And from that place, when you have an effect, you can have a much more dramatic effect that affects multiple outputs. So a simple example would be if you think about stress. So just stress alone, aside from affecting sleep, affects our own metabolism, which affects our weight gain, which it also affects our anxiety levels, it affects our blood pressure. So you have multiple outputs from this one core source. And then, of course, within stress, then you go deeper and figure out what are the core aspects of stress. So that, as an integrative medicine physician, is something that's important to think about. To give a little color to my work, I run a practice called Blue Wave Medicine that many of you participate in or know of. And we run these Tuesdays to Your Health workshops historically at Cavallo Point Lodge, which is currently closed, but it should be reopening in the next few weeks to months. Different aspects, whether it's the Healing Arts Center and Spa, the restaurant and the hotel. And we're going to continue to do this live stream broadcasting once we're back at Cavallo Point. In the interim, this is my home office, so you get to see where I'm at for my home office. In addition, some of the other work I'll just share with you relates to some of my work in what's called the Academy for Integrative Health and Medicine, which is a national nonprofit focused on teaching people integrative health and medicine, and it's multidisciplinary. So we have folks from all walks of life that are in the health profession and bringing them together. And thankfully, a lot of us really are able to come together from all walks of life, whether it's an acupuncturist, a pharmacist, a body worker, a physician, and then form chapters. So there's a San Francisco chapter, there's a range of chapters, over 100 chapters throughout the country. So I invite you, if you're a health professional, to consider looking into that. They're free to attend, and they're usually held quarterly or monthly. Another venture that I'm involved in is a nonprofit called Humankind Now. It's a 501c3, and we're focused on procuring PPE. So for those that need protective equipment, personal protective equipment like masks, goggles, gowns, gloves, and can't get their hands on it, we actually raise money and we also get donated PPE, as well as raising money. They can go purchase PPE, and then we go and turn around and donate that, give it away to individual health professionals that need them, or healthcare systems. You know, we've given a lot, most recently to Navajo Nation, also to Medicine Without Borders, Doctors Without Borders, I should say, as well as certain healthcare systems, both locally in the Bay Area as well as across the country. So I welcome you to explore that. And then finally, there's, for those that are in the menopause phase of life, there's a company called The Cusp, and we're focused on women transitioning through menopause. So tonight, I want to spend some time thinking about our sleep. So let me go ahead and share some of these slides and see what, if this is, could provide a little bit of color for you. So when you think about sleep, I think what's most relevant really relates to, as I said earlier, our thinking around a holistic approach. So what does that holistic approach look like? At its core is self-care. The next layer out are things that require a health professional to help you, to help stimulate that sort of self-healing capacity. And then only after that do you think about supplements and pharmaceuticals or procedures like surgery and things like that. Now, of course, this is not how I was trained. Many medical students who are physicians aren't trained this way, unfortunately. I'm trained more what you see on the left-hand side, which is the main meat and potato as a medical doctor, is devices, surgeries, and drugs. And then on the side, the periphery is all the things that actually are self-empowering, such as self-care, lifestyle change. Psychotherapy is something that most physicians have no understanding of. Their only reflection is psychiatry, which is really mostly focused on pharmaceuticals, unfortunately. And then CAM therapies, which are complementary alternative therapies, so acupuncture and things like that. But we're gonna, as an integrative model, which is really where we are today, thank goodness for most of us that are interested in this, we're gonna focus on the right-hand side. I love this this piece of artwork because it really helps us reflect on what happens in our dream state. You know, it's as we move from being awake and alert in this reality, we have this transition that no one really understands, and we move into the dream state where reality is fluid, where it's manipulatable, where things don't make sense at the conscious level, but later maybe or sort of foretell something that you didn't quite realize was going to happen in the future. It's really an area where we have access to our subconscious, and it's a mystical place that no one understands. We know deep healing happens here. We know memory gets consolidated during this phase. We know our immune system gets rebooted and amplified during this phase. And we know a lot of good happens. You know, as Professor Dement said, who's from Stanford, who really was one of the first early researchers in this space, dreaming permits each and every one of us to be quietly and safely insane every night of our life. It's an interesting thing to reflect on. So as we move to think about sleep for a moment, I'm going to really be focusing on the standard sort of bread and butter things of insomnia. That's what I really want to give attention to. And this is something that many Americans suffer from. Most doctors don't talk about it, and it increases as we get older. And you can see in this survey here that you have a huge number of people that almost every night are having issues. That's a third of the population. And down to the remainder, if you look at the balance, you have 20% that say rarely or never do they have problems with their sleep. So 80% of the people are suffering. And over time, it seems to have gotten worse. So what are the changes? Really, a lot of it has to do with media and electricity. So first came electricity, and that shifted us dramatically. So how did that shift us? It's really fascinating to think about what happened. So when you think about electricity, so before there was electricity, we had, gas lamps and things like that. For the most part, the lights would go down when sunset set, and people would move to the night phase, which, 6, 7 o'clock, depending on where you were, what latitude you were in. And people would then have basically 12 hours roughly of evening. And that evening often would be moved into repose. So people would fall asleep and maybe call it 8 o'clock, and they awaken 6, 7 o'clock in the morning, or maybe they fall asleep at 7 p.m. and wake up at 5, 6 a.m. So you had 10 to 12 hours of this night phase. And if people were sleeping that long, they had what we call the second honeymoon. So often what would happen is people might wake up, they'd sleep 4 hours, they might wake up, they might do a little bit of poetry or writing or play some music or make love to their spouse, and an hour, it didn't matter, they go back to sleep an hour or two later, and they sleep another 4 or 5 hours. And so they'd sleep collectively 8, 9 hours. And there'd be no stress about it because it was within a 10, 12-hour window. We're very different now, right? So we're up looking at our screens. When electricity came, then all of a sudden we had lighting, it was evening time, and we could keep the lights on as long as we wanted. And I don't know about you, but when the lights are on, I'm awake. It's only when I turn off the media, television, social media, then you realize, and sort of quiet down, do you realize just how tired you really are. And as a result of that, we've seen a huge sleep debt. And I think that's our biggest problem for most of us, because that just gives us a whole bunch of stress. And so when you think about our collective sleep debt, you really realize that this is a debt that's going to be quite difficult to repay. Now, what happens? We know that people's performance decreases, people can have more accidents, they have more injuries, their quality of life goes down, and they're more likely to become depressed or increase their anxiety and cognitively not perform as well. So my first short answer before we start going through a whole bunch of data that looks at different aspects of this at a very high level, I think what's really most important at a high level is that we think about how do we shift, and I know personally this is a big issue for me, how do we create more elasticity in the time-space phenomena that we live in? How do we create more elasticity? In other words, when we're running if you're a primary care doctor seeing patients in an insurance model and you're seeing patients every 20 minutes, how does someone live their life? Going bump, 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 right? Or for most of us moving from one thing to the next, and we stack, our level of stacking is so broad and we're multitasking, we really have a difficult time creating some elasticity. What happens in that light? We get much more stressed. We have much shorter attention spans, much shorter tolerance, and everything gets compacted. And so our stress levels go up, our cortisol levels go up, our anxiety levels go up. And then we are more prone to anger, we're more prone to feeling depressed, where all these emotions get exaggerated. And then all of a sudden, and now imagine we layer on the effect of social media and television, everything we're watching, all that input that's coming in, that's our break time. We move from whatever we're doing during the day, and now we chill out by going on social media or reading, which currently in the current news is quite emotionally rich, shall we say. How do we move and then turn off the lights and expect to have this wonderful night's sleep? So clearly we need to create some space. Clearly we need to build in more elasticity. Clearly, and some of the silver lining in this lockdown has been, what does it feel like to have more space in our lives? What does it feel like to have more time? What does it mean if we shut things down a little bit earlier? and give ourselves 10 hours for our sleep time, so that if we wake up for an hour or two, you're still getting 8 hours sleep, rather than going to sleep at 11 o'clock at night and being up at 6 a.m., which gives you 7 hours. And if you wake up for an hour or two, now you're getting down to 5 hours. So I want to sit with that a little bit as we continue to go through some of these slides. And I'd like us to really reflect on, in the background, how can we find more space in our life? So if you look at the next sort of topic, the association between sleep deprivation and depression. So what do we know? We know that if you take a whole bunch of teenagers, you follow them over a year, and sleep for less than 6 hours at baseline, what had happened? It predicted subsequent depression a year later, and further sleep deprivation after controlling for the depression. So it's a vicious circle. So if you don't sleep much, it predicts the likelihood that you will become depressed. And it predicts the likelihood that you have continued to have disrupted sleep, which then furthers your risk for depression. So this reduced quantity of sleep really increases risk for depression, which in turn increases risk for decreased sleep, which then increases, and it's just a perpetual cycle. So again, go back to how to create more elasticity. One basic recommendation I tell people is, just spend 1 week, dedicate 1 week. That's all. Run the experiment for 1 week and explore, what does it feel like to give yourself 10 hours lying in your bed? So maybe you read for 20 minutes, you get tired, you turn off the light. You're in bed. Maybe you wake up because you're not used to it. You don't know what to do with yourself. The first couple nights you're getting used to it. Even then, see what it feels like. Just say, I'm going to run the next 3 days or the next week. It's not going to be forever, but I'm going to experiment what it feels like to do this for 1 week and see how things shift. So I invite you to really consider that. What I'd like to really then think about is, which sort of, they're all really related, and that relates to perceived stress. So if you think about our perceived stress, what does that look like? If you think about this a bit, let me just give you a slide here so you can see exactly where we're going. What we know is that there's these things called telomeres, which sit at the end of every chromosome. Very end, you have these things that are like cushions, if they will. They protect the actual cell from dividing and causing a mutation, which then can lead to a cancer or some other defect. And so as these telomeres get shorter and shorter, the cell eventually stops dividing and will, at its next division, it will self-destruct, or apoptosis, we call it. So what we know is that when we're highly stressed, we actually shorten these these telomeres more quickly. So that the actual cell itself, or the chromosome itself, actually ages more quickly. And if you look at this study amongst adults with HIV, they show that those that sleep less than 7 hours compared to those that sleep more than 7 hours, those that sleep less than 7 hours actually had shorter telomeres, meaning that they were actually aging more rapidly. This is basically effectively, folks, adults 22 to 77 years of age. So clearly sleep deprivation increases cellular aging, increases our own aging. Look at any president. Forget the stress that they're put on overall, but the lack of sleep that they have. I was just listening to Anthony Fauci talking about he's working 18-hour days. Like, the amount, our sleep deprivation will age us dramatically. And so what are some of the consequences? It's really interesting. I was just having this conversation with a patient of mine. And what we find is that the sleep deprivation actually has multiple effects. So it affects our physiology, which then affects multiple other outputs. So what does that mean? When we don't sleep enough, we end up having this dilemma where our body thinks it sort of shifts over to starvation mode. And so all of a sudden when you're eating, it takes that food and actually tries to store it as fat. So you're much less likely. I know several people that are trying to lose weight and they can't lose weight, and they also have sleep disturbance. You solve their sleep disturbance, all of a sudden their weight gain improves dramatically. And the reason is our physiology changes. We have increased cortisol levels when we don't sleep as much. We have reduction in our glucose tolerance, meaning that we're much likely to have what we call insulin resistance. And we can even have effects on our thyroid. And so all these things, as well as sort of these cortisol levels going up, activating our sympathetic nervous system, all these things lead to storage of fat, storage. So eat calories, store it. Eat calories, store it, because we're afraid what's happening. We're under attack, we're under siege. So again, it has multiple outputs in addition to just really feeling tired. In addition to all that, or related to all that, or these age-related issues as well. So stroke risk, obesity risk, we talked about diabetes, cardiovascular disease, and even osteoporosis. So it's really important to really give some thought to those things that are far more sort of precarious than we thought they were. So when you think about the different stages of health, of our sleep, there's a few, several to really give some thought to. So the first one is about really REM. So if you think about REM sleep, what does that look like? So REM sleep really is when we're actively sort of engaged, our mind is engaged in hallucinating, but our body is paralyzed. And you have this, this characteristic eye movement, right? So that we all think about when we think about REM sleep. And you can see it in the EEG, and almost like in the EEG, it looks like the person's actually awake because their mind is so active. But the body's paralyzed, and I'm sure some of you have felt this before, where if you've ever been awake in a dream and you can't move your body. And there's a good reason for that. Obviously, if you're going to jump off in your dream, jump off and go fly, you wouldn't want to get up and go fly. So that's really a main piece of that puzzle. Now, what else is there? There's a deep sleep that's non-REM sleep as well. So within non-REM, we have stages 1, 2, 3, 4. And this is in the non-REM, non-rapid eye movement sleep, you have this idling brain with a movable body. So you can move more. And that's how all these apps, like they have this Oura Ring and there's Fitbits, there's a range of things of different, different wearable devices. And they do a good job detecting between movement and non-movement, really. And from that, they make these derivative explanations where they think they know what phase of sleep you're in. And during these different phases, particularly deeper phases, is really where you can have a reboot. So stages 3 and 4, which are the deeper stages of non-REM sleep, is really where you can get a hormone growth, human growth hormone pulse, which really promotes healing. You get a reboot of the immune system that we talked about. You get consolidation of memory. So you get new neural connections. Innovation happens during that time phase because you're making these new connections. And of note, certain herbs and medications may suppress stage 3 and 4 of sleep. So for those that are wondering why their sleep disturbance is worse over time, that is something we don't fully understand in the aging mind, but we do know that there are definitely changes in the sleep architecture. And so that's why it's classic. You see people napping as they get older in their 70s and 80s, and sort of unconscious, they just start napping. I love to nap, so I actually took a 15-minute nap before our talk here today, because for me, it's a great reboot. It gets your attention level up, your energy level back up, and your focus. And if you sleep longer for these naps, you can actually get improvement in cognition and other factors as well. And we'll talk about napping as it relates to sleep in a moment. So the other pieces are circadian rhythm. I think it's really important to give some thought to our circadian rhythm. And this goes back to the original conversation that we were having, which is really that what we do know is that when people are more evening-like folks and they stay up till 1 a.m. and past, versus folks in sort of the middle, versus those that go to sleep earlier, we know that those that are the late nighters, that are sort of the owls, and they sleep in late, there's actually increased risk for them around mood disturbance, increased risk of non-remission depression, and of insomnia severity, which sort of goes back to what we were talking about earlier in the beginning of this conversation. when those folks can make a shift, we find there's actually a big shift in their own mood and in their quality of their sleep. So there is an independent association of what we call eveningness with this persistent depression. And we find that circadian involvement is really related to depressive disorder. And so it's real important to, give some thought to how do we spend our time in the evening, which goes back to my earlier conversation in the beginning about what do you do with your off time? So you're working, you're getting a lot of things done, and now you want to, treat yourself to some downtime. What is that downtime? We know that streaming media is huge now. Netflix, Amazon Prime, the list goes on, and many of us spend a lot of time watching that. Now, I, for one, am not someone that will fall asleep in front of the TV. If you keep the TV on, I'll be up till 3 a.m. It's only when I shut it off do I realize just how fatigued I am. And I don't know how many of you have that experience, but I'd run the experiment. And I'd invite you to consider shutting down all the stimuli coming at you earlier. I'd invite you to eat dinner earlier. It's a beautiful time to be outdoors with the way the weather is these days. And if you want to be social, then be outdoors socially in your backyard, so appropriately socially distanced, enjoying a nice dinner early. You come in at dusk and wind the evening down and run that experiment and notice if things shift. Notice if your mood shifts. Notice if your ability to get quality sleep really goes through a shift for you. So what else can we think about? I invite you to sort of think about when I say I'm having sleep disturbance, what exactly is that sleep disturbance? So you can typically break it up into 4 categories when it comes to insomnia. You have difficulty getting to sleep. You might have difficulty once you're asleep, staying asleep, which we call maintenance issues versus onset issues. And then some people wake up early, 5 a.m., 4 a.m., and they don't want to be awake that early, and they have trouble getting back to sleep. And then those that after all said and done, they wake up, they're just exhausted. So when you think about these, often the first 2 buckets, those difficulty getting to sleep and maintaining sleep, relate to the mind. And the mind is typically ruminating, worrying. And what's classic really is that they will either be we will be projecting our mind into the future or reflecting into the past and not be in the present moment. Because there's nothing happening in the present moment. You're lying in bed, the lights are off. So we can talk about light and sound and things that are happening in the present moment. But for most people, the primary issue relates to their mind projecting to the future or into the past and not being in the present moment. Now that remains true even upon awakening through the night, because what happens is if our mind is still ruminating and worrying, we drop into sleep. And our sleep will technically have sleep disturbance, and some of those issues will weave themselves back into our dream state. And then when through the night, we then wake up thinking about whatever it was that's on top of mind. So that's really an important aspect to really give consideration to, is the mind and what we can do. And we'll talk about that in a sec. Then early morning awakening, a really important aspect of this is depression and particularly grief. So people will wake up early in the morning, and it's important to think about if they're waking up early in the morning, they don't want to be awake. In other words, you want to sleep till 6 or 7 a.m. or later, and you're waking up at 3:30 or 4:30 a.m. and now you can't get back to sleep. It's an important warning flag to think about mood and think about depression. And then finally, awakening about rest, not feeling rested. For those that feel like I sleep all night long, I don't really understand why I'm waking not feeling rested, it's important to think about some medical issues that might be related to. In addition to, and it's important to think about sleep apnea, obstructive sleep apnea, where people will have multiple episodes through the night. And during these multiple episodes through the night, they stop breathing. So obstructive meaning there's an obstruction, sleep apnea meaning not breathing. So some of the tissue typically in our throat and posterior pharynx collapses as you breathe in. You can't get the air in, you get no air, and you might wake up, or you might just and then go back to sleep. It's an immediate, or you sort of go to, you know, a light state, asleep, and then drop back down again repeatedly over time. You have multiple desaturations on your oxygen, meaning that you're not getting air in, therefore air doesn't get to your lungs, therefore oxygen doesn't go across into the bloodstream, therefore your body's not getting the oxygen it needs. And that can lead to disturbances. You can have dozens of these happen through the evening. And when that happens, you chronically can develop memory loss, because you're getting these hypoxic hits, low oxygen moments through the night after night after night, as well as many other problems. So increased blood pressure, risk for diabetes, on and on. So it's important to think about that. If you're concerned about that, to get tested. There are companies now that will do home testing, so you can do it at home. There's a company I work with that I have no investment in, but called Sleep Quest. It's important to give that some thought. And then, so what the other question is, so what are some of the medical causes? And if you think about what are some of those medical causes, you might want to think through about the first one we just spoke about, and then, for example, hyperthyroidism. So if your thyroid's too active, that's a problem, because it then cranks up your whole system. And so people tend to have racing heart, they tend to be more anxious, they tend to have trouble sleeping, they tend to be able to, even though they're eating food, burn through the food because their whole metabolism is revved up. Other issues as well. So heart failure, neurologic disorders, and other issues can lead to sleep disturbance as well. And there's also medications. So, you know, look through what medications or substances you're taking. Nicotine, for example, is clearly stimulating antidepressants, decongestants. These all can have effects on our sleep, as well as calcium channel blockers and beta blockers, which typically used for blood pressure or heart rate control. And alcohol, which is the hidden one that everyone uses. And for those that don't know, alcohol has increased 43% roughly over the past several months, since everyone's been in the shelter-in-place mode. And that definitely can disrupt sleep. And I've run these tests myself. So if you know, myself, when I drink alcohol, I have this ring called the Oura ring. And this ring has these little trackers in it, if you can see in there. And it will monitor my sleep and my heart rate variability. And it, interestingly enough, will show my heart rate is higher on the nights I drink alcohol, and I have many more awakenings through the night. So run the experiment yourself. Don't drink for a few nights, see how it changes. It's quite fascinating. We typically then will evaluate people as a clinician. I'll ask them about all the things we talked about. What are your habits? When do you eat? Don't eat too late at night, because then you're digesting food and you have gas and disruption, and that can disrupt sleep. What are the medications you're on? And we'll do a physical exam to think about your thyroid, listen to your lungs and heart, make sure you don't have cardiovascular disease. And then we'll do some lab testing. You know, we'll look at hormones, for example. Perimenopause is a phase, for example, for women that are going through menopause or perimenopause, which, by the way, the average age is 51, but the range is 40 to 60, is to think about, as hormone fluctuations are happening in a woman, that can disrupt sleep for certain, directly or indirectly through hot flashes, and so other related sort of effects. Also, so we'll do a full sort of, if you will, a workup, and with that, keeping that in mind. So the other piece to really give some more consideration to is, what are some of the things you can do about it? So if you think about, there's a few different aspects that to really give some thought to. I like to bucket these into a few different ways. So I feel like the nice way to think about this is, if you want to think about things you can do for yourself, and then stuff you're going to take by mouth, into sort of two big buckets. Stuff that you can do for yourself, the lifestyle things. Exercise is an important factor. Meditation or some sort of wisdom practice or reflection, contemplative practice of any sort, yoga, tai chi, meditation, is quite useful, and is really an anchor and foundational piece, as well as prayer, and the reason is that our breath can directly modulate our nervous system. which we'll speak to in a few more minutes. Sleep hygiene, so keeping a regular schedule, not having too much, having the room appropriately so it's the right temperature. Maybe the window's open to have a breeze so it stays cool. Maybe you have layering on your sheet so that you can peel off layers as you need to, or layering in your clothing. Sound and light, so using earplugs, having eye covers are all relevant with respect to your neighbors and sound related to your neighbors. So all that is really important to set up the right atmosphere. And then before you're going to sleep, what are you doing the hour prior? Again, shutting off screens. That's been shown to reduce melatonin levels when you watch screens. Melatonin is related to your ability for sleep onset. So you want to turn those off so that you don't have that, as well as the emotional content that comes with that as well. Often doing a practice, whether it's drawing a bath or lighting candles or some sort of ritual that you do that helps you get to sleep. It's the old school of warm milk and cookies, but don't recommend that necessarily. Perhaps an herbal tea is a really important piece. And then cognitive behavioral therapy, which we'll talk about in a moment. And then we'll move some of these through these other categories as well. So we covered most of the self-hygiene piece. As you think about the mind, thinking, and breath, behavioral therapy can be really helpful, done through psychotherapy with folks that are trained in this, as well as cognitive behavioral therapy itself. Cognitive behavioral therapy really is the goal is to change the pattern of harmful thinking, establish a regular wake-up time, get out of bed during waking periods, which I'll speak to in a moment, and avoid eating, reading, watching TV in bed. So trying to make the bed, it's for romance, intimacy, and it's for sleeping, not for watching TV, not for doing your work. It helps condition you that when you walk into that room, that's what it's for. And that really can sort of change. Now, they say eliminate daytime napping. I personally think napping can be helpful, but everyone's a little different and needs to run that experiment themselves. When it comes to waking up in the middle of the night, for those that do that, I recommend that you spend a moment just bringing yourself back to your breath. Now, some people, you can literally count sheep. You could count your breath. You could go through a progressive practice where if you're sort of focusing in perhaps on between our eyebrows and the tension that's being held there and trying to relax that area, then you could even notice the breath as it comes in out through your nose. And why don't we spend 5 minutes here and we can just run through this practice so you have some direct experience. So if you are comfortable sitting, please sit. Get yourself in a comfortable position. And I encourage you to uncross your legs and uncross your hands and place your hands comfortably on your lap, on your legs. And then imagine you're up in the middle of the night. So what are you doing? So the easiest way in my mind is to bring our hands onto our body so that we come to our body and out of our mind. It's to direct ourselves by embodying ourselves, because there's nothing going on with this body. It's lying in bed and it's requesting repose and recovery and restoration. So to just tap back into that. So I invite you to keep your eyes open if you'd like. You needn't to look at me. Look down about 6 foot in front of you with a downward gaze. Or you can close your eyes if you'd like. Place one hand over your chest and the other hand over your belly button. And just feel your body and notice your breath. Now I invite you to count your breath. So as you breathe in, count for a count of 4, 3, 4. And as you breathe out, count to a count of 5, 2, 3, 4. Breathe in and out. 3, 4, 5. In, 2, 3, 4, and out. 1, 2, 4. As you breathe in and out, your mind may wander. It's normal for the mind to wander, and really what's happening is as we draw ourselves into our breath, it ends up shining a light onto the monkey of the mind that's jumping all over. The mind was always jumping all over. That monkey's always been there. But now that we're just simply giving our direction of our attention directed towards our breath, all of a sudden a flashlight goes onto the lamplight, if you will, goes onto the monkey. And so our mind starts noticing the monkey. And sometimes it feels like there's multiple monkeys. And the beautiful thing is, when that happens, you're having the realization that there's these thoughts that aren't me. There's a monkey there that's not me. That realization takes you, because there's somebody realizing that within you. Therefore, you're now separate from your thoughts, because you're looking at your thoughts. You're looking at the mind that's churning. That freedom, that separation between your being that's watching your thoughts, is the freedom that gives you the choice to then redirect your attention where you want it to go. So then it comes back to your breath again. It'll go right back to your thoughts, maybe a minute later, maybe 5 seconds later. And then again, you just bring it back to where you want it to be. It can be back to your feeling, as simple as feeling your chest rise and fall with each breath, which I encourage you to do. Or you can choose a counter breath. As you breathe in, count to 4, and as you exhale, to a count to 5. So I encourage you to do that practice for 5, 10 minutes and see how that feels. Your mind still may be churning, and you might find 15 minutes later that you're awake, or you may find you just drift off to sleep. After 10, 15 minutes, if you're feeling like, I'm getting frustrated, like this isn't really happening for me, then I encourage you to get out of bed, to keep the lights down. And I encourage you to do some stretching, to further come to your body. By coming to the body, you leave the mind turning and you embody your being, which allows the thinking, ruminating mind to move to the background. And you can do yoga, you can do some general stretching. I encourage you, for those that want you could do glow.com, I believe it's called, that does yoga. The Peloton now serves yoga. There's several places, you go into YouTube, there's several yoga places that you go, that's web streams, many of it's free. And I encourage you to learn some practices like that. Then come back to bed, 10 minutes of that or so, and go back to the breathing practice I was mentioning, the embodied breathing. And often you'll fall asleep. If after 20, 30 minutes of that routine, you're still finding yourself agitated and not being able to go to sleep, then I would suggest you leave the room and go read somewhere, do something that's relatively mind-numbing, whether it's a documentary or that you're watching or listening to, or you're reading a book that goes through the details of the chemical formulation of some complex chemical that'll put you to sleep, and then bring yourself back to bed. So that's the main practice for you to give some thought to, that I encourage you to do, that is dramatically effective for many people, particularly when they drop into it in a deep manner. The other aspect of it, and this graph just really is speaking to the blue line being folks that are projecting themselves. So they're not in the present moment. This challenge has gone away and they're still churned up physiologically. You got a car, someone cut you off in the car the other day, and you're still lying in bed thinking about it. The red line is the person who's just in the present moment, right? The green line is a person that gets run over by the truck because they have no response to anything that's being challenged towards them. So you want to be the red line. Now there's some great trainings, particularly now online. The Beck Institute has one, the University of Pennsylvania has one, and it's using cognitive behavioral therapy, which has been shown to be as effective as drugs, so as sleeping medication. And here's a study here that really has looked at that. It's with 6-month outcomes. Here's another study also showing this, where they used Lexapro plus 7 sessions of cognitive behavioral therapy versus Lexapro alone. And they found that insomnia improved by 50%. So people got remission rate of 50% versus just the medication alone, 7%. And for depression itself, 61% of the people had improved depression versus only a third on Lexapro alone. So if you think about all of us that have mild or major depression and sleep disturbance, almost a two-thirds benefit by doing cognitive behavioral therapy with our medication Lexapro, if you're taking Lexapro, versus only 1/3, which is basically the placebo effect, 33% from the Lexapro all by itself. And the really interesting piece about this is it related to sleep quality. So it didn't mean they had to spend more time in bed. It meant their quality of time while in bed was improved. So they may have lied down in bed for 8 hours and gotten, previously they were getting 5 hours sleep, now they're getting 7 hours sleep with the same amount of time being in bed. It's a profound benefit. A bit of cognitive behavioral therapy is typically 8 sessions. It's very sort of directed. There's a curriculum about it, and you sort of walk through this curriculum, and it really teaches you to notice your mind, notice some of the banter that goes on within our mind, the dialogue, and sometimes we're sort of beating ourselves up, we're feeling guilty, we're catastrophizing. There's a lot of different ways we behave, to notice that and redirect. So that's a really main piece. So, and there's some other interesting things to be thinking about. We talked about mindfulness and we did this practice. There's a lot of neurobiofeedback apps. So you can think about different ones, like this one here, that it's a band, that's sort of a headband that you wear with an app associated with it called the Muse. And this one can either give you active feedback. It'll sort of give you active feedback in real time. You can sing. One of the options is it actually has a soundtrack, and that you're in the forest, and as you're bringing yourself to the present moment, because it's monitoring your frequencies and your brain waves, it knows when your mind's thinking or when you're dropping into a meditative state. And when your mind is thinking, it's a loud rainfall and it's like a storm. And then as you quiet your mind, that distracts your mind, and you're thinking, why is it so loud? Wow. And you realize, oh, I've been thinking. And then you just bring yourself back to your breath. And as your mind quiets, the storm goes away, the birds start chirping, the river starts flowing, and things start sort of brightening in the forest. It's a wonderful neurobiofeedback tool, and I highly recommend it. It's great for kids. I've given it to my kids. They play with it because it's somewhat gamified. You can see you get birds and recoveries and all these ways where they gamify it. So that's a great neurofeedback tool. For those that are snoring and sort of that's waking up their spouse, and that's why the spouse is maybe having problems, or your own snoring perhaps as well, there's devices and other solutions. So this one actually is quite interesting, where it actually inflates. So you put this under your pillow, and when you're snoring, it actually inflates and lifts the pillow up so that it changes your body position, and it actually can reduce snoring. It can give you these snoring. There's an app that actually measures people's snoring. So if you don't think you're a snorer, or if your partner doesn't believe that they snore and you say they do, you can get these apps that will measure using the phone. It uses the microphone. It can measure your snoring. And Epic is the loudest, if you will, and down to quiet. And you can see dramatic shifts in the score with this particular device that I showed you. I've had several patients and friends that have used it and had huge shifts in their snoring. So at least that'll help your spouse out, if not yourself. So what about some different therapies? Herbs can be a great choice to help sort of set the mood. Often you can do them as teas. So valerian is wonderful, hops, lavender, lemon balm, chamomile. Many of these are good for the stomach as well, such as chamomile. Valerian's been used for, it smells like stinky socks. It's been used in Eastern Europe for ages. Lavender is delightful with its aroma. sort of the opposite of valerian in hops, as you know, from many things like beer. So there's lots of different herbal options, and I recommend the herbal formula as a tea can be helpful. Traditional Medicinals is a good company that actually makes high quality teas at a medicinal dosage. So I'm a big fan of those guys, and there are others as well. Melatonin's been shown to be, as you know, quite effective. Many of you have used it. It's good for jet lag. It's also good for reflux, actually reduces reflux, and has been shown to be quite helpful for many people, and I recommend that. I'm also a fan of magnesium, which I don't think I included on any of these slides. You can, one of the questions asked earlier before the workshop started is around what type of magnesium. Glycinate tends to be better tolerated than magnesium citrate. Magnesium glycerate instead of magnesium citrate. But most of them actually, in my experience, have had similar effect for sleep onset. Calm, I think it's called Natural Vitality, is a product that works quite well. I typically recommend 150 to 300 milligrams of magnesium. It can be sort of in different formulations. Some of them have more laxative effects than others. Magnesium itself, one of the wonderful things about magnesium is that it helps the bowels. For those that are constipated, it's great for muscle relaxation. It's great for blood pressure, and it also helps with sleep. Valerian, we talked about, it should be formulated. Ideally, if you're taking a pill, it really needs to be a standardized extract taken in this manner, as well as a lot of people who have a lot of success using 5-HTP. 5-HTP, which is a precursor to serotonin, is a tryptophan, and also can be helpful for a lot of people. So there's a range of products out there, passion flower as well. And it's products that have a combination formula. For example, Gaia has one that has valerian root and passion flower, as well as some other things in the mix like lemon balm and California poppy flower and lavender, etc. And I actually think those work quite well in the combination formulas. Here's another example. Zymogen makes something called Cortisol. There's a similar product by Integrative Therapeutics called something like I think it's called Cortisol Manager, and they can be quite helpful. Now, what about marijuana, THC and CBD? So there's all sorts of products out there. And so, what's the thinking about that? So for some people, marijuana can be quite activating, particularly when it's the THC component we're talking about. For several people, they use marijuana and it's an activating, even the indica, which they say within THC, there's general sort of buckets of sativa and indica. Sativa being more activating, indica being more body-based and more calming. And so if you see some of these formulas that say sleep or bliss or whatever that are all about sleep, they tend to be the indica formulation. Even for a subset of people, those can be quite activating, and people can get more anxious. So I recommend you try it, but use it sparingly and see how it affects you. The CBD is a non-psychoactive form. So THC is psychoactive, gets you stoned or high. The CBD is non-psychoactive, and for many people, it's calming and it's sufficient. And since it's not psychoactive, people like it a lot better. This has been used. I have patients in their 80s that use it, and the CBD formulation and do just fine. So it comes in all sorts of different tinctures and sprays and pills and smokable and non-smokable, and really everyone's a little different. What I do recommend and be cautious about is that these things are highly potent. These are 28, 38%, 40%. These are very potent. Back in the 70s and 80s, there was 5%, 7% potency. So we're talking 6 times more potent or more. So start at a smaller dose. They say traditionally the dose is 10 milligrams. I would suggest you start at 2.5 milligrams and move your way sort of up accordingly and judiciously. So let me just share a few more slides with you before we begin to wrap up. This is one of many dispensaries where you can get these sorts of things. And it's very difficult to know which ones are best and which ones are not. There's lots of different online reviews and ways to figure out which ones are organic and which ones are putting pollutants in it. You know, outdoor is better than indoor growing because they don't use as many chemicals. So I do recommend people try and identify organic and outdoor growing rather than indoor. And local tends to be better than non-local for those reasons, which is becoming more difficult. When it comes to medications, the point of this slide is really that the number one seller, or I should say, the number of dollars spent for direct-to-consumer pharmaceutical advertising is spent in the domain of sleep, since so many of us have sleep disturbance and so many of us use medication for it. All of these medications have potential issues. Many of them are now being associated with Alzheimer's, dementia risk, cognitive decline, whether it's trazodone, whether it's Benadryl, or potentially Ambien and other benzodiazepine-related medications. So that if you use it, I recommend you use it sparingly and in the lowest dose you can. And they often can be wonderful as an additive during times of crisis or time difference changes, et cetera, but underneath the foundation of all the things we talked about prior. So as you know, some of these have been associated with memory, sort of short-term memory, sort of retroactive amnesia, as they call it, or particularly this class of medications where people don't really remember that they actually went to the kitchen and ate a whole bunch of cookies or walked outside naked. And these unexpected side effects that people weren't aware of. So, in general, my overall summary really around this is that we use way too many medications and there's so many more things that are more potent. I do think people should think about sleep apnea, obstructive sleep apnea, as a potential issue if you have disrupted sleep. Of course, if you're worrying, you have the ruminating mind, that's a different category of things, and most of us have that experience. And I do encourage you to really give some thought to running the experiment of shutting things down early, having an early dinner, and getting yourself ready for bed and shifting for much earlier, 2 hours earlier than normal. And just see how that feels and run that for a week, that experiment for yourself, and really get a sense for how that feels for you. So I'm looking and don't see any questions at this time. So I want to give one more moment for anyone that wants to put any questions in. I had one question come up, which is, what do you do if you wake up at 5 a.m. and why am I waking up at 5 a.m.? It depends what view and lens you think about for that. For some people, waking up at 5 a.m. is related to grief. The 3 to 5 a.m. hour from a Chinese medicine perspective relates to the lung and the large intestine and can be associated with grief. So that may be one thing to sort of reflect on and think about. From a Western medical perspective, I spoke about earlier about early morning awakening, where you're waking up earlier than you had hoped to or planned to and can't get back to sleep. Again, is associated with depression, which again relates back to the Chinese medicine perspective as well. Some people also just have requiring shorter amounts of sleep time. And again, I would run the experiment, see what happens if you front load your sleep and see if you still wake up at the same time at 5 a.m., but now you're going to sleep at 9 a.m. instead of 10:30, and now you're getting more sleep through the day as a result of that. Well, I want to thank everyone for their time today. I'll ask, there's one more question that came up, so let me address that before we close, which is, what is the physical action occurring with alcohol intake as it affects waking up at 3 a.m.? Yeah, so we don't know, or I don't know the specific neurophysiologic effects of alcohol. There's many, but we do know it affects our stages of sleep and it affects our physiology. So we do know that it increases heart rate. We do know that it's more activating, so it activates our sympathetic system, sympathetic nervous system. And so, but I don't know directly the effects in the sleep architecture and why it's affected, but it may be through those pathways. So I thank everyone for their time, and we do this once a month. Feel free to come back, and appreciate your thoughts. Feel free to share this when we post it on YouTube with others. And we're also posting talks that we're giving on coronavirus 19, which I do a talk typically every other month, or I'm sorry, every other week. And so you're welcome to participate in that as well. Just go subscribe to my YouTube channel and you'll get an automatic alert. So may you all stay safe. May you all find a way to participate in the current social justice activity that's happening around our planet. And may we all find a path forward that brings more sanity and harmony and security to all of us. So I wish you all well. Bye-bye.